Thanks, KG, and good morning, everyone. My name's Kumanan Rasanathan, and I'm a board member at Health Systems Global, and I've worked across a range of fields in public health, mostly in health systems and maternal and child health. It's my great pleasure this morning to chair this very august panel on what I think, as KG said, is the driving question that animates this workshop, on how do we move beyond this roller coaster, this cycle of panic and neglect, where we move between great levels of attention and essentially silent neglect. This is an issue that I have sort of thought about for quite a long time in my life. In fact, when I was a schoolboy, I stumbled across the fact of the mortality in the Spanish flu and was intrigued that I hadn't really heard much about it. So I did my final year assignment in history at secondary school on the Spanish flu in New Zealand, where I grew up. In New Zealand, the Spanish flu killed about 1% of the population by conservative estimates. But to that, you should also add the fact that New Zealand was culpable in Samoa losing 22% of its population, because the passenger and cargo ship Talune sailed from Auckland, arrived in Fiji where it was quarantined, but they went to Samoa where it wasn't quarantined, and introduced the Spanish flu, which, as I said, wiped out 22% of that island's population. And yet, despite this, and the toll from the Spanish flu in New Zealand was slightly less than the toll from World War I, which is always commemorated, is often seen as the birth of the modern nation of New Zealand. The Spanish flu was something I hadn't really heard about much, and I thought that this sort of contradiction warranted more inspection. And when I went through the microfeatures, as you did at the time, to look at the newspapers, it wasn't that it wasn't covered. There were all those stories of tragedy, of the efforts that people made, of the uncertainty. It also led to a lot of differences. There was, the Minister of Internal Affairs promised the most open internal inquiry at the time, and it led to the Epidemic Commission in 1919, which found that the Department of Health was understaffed and that they had acted far too slowly. One newspaper at the time said that the graves of the victims of this dreadful scourge were great monuments to incompetence. And the Epidemic Commission directly led to the 1920 Health Act, which transformed health in New Zealand. And yet, despite this activity and all these stories that were easily found, if you looked, it wasn't something that was in the national conversation. There had certainly been that cycle of panic and neglect. But then even I myself then essentially forgot about the Spanish flu until I worked on New Zealand's pandemic preparedness plan in the aftermath of SARS in 2006. So how do we move beyond the cycle of panic and neglect? Arnold and Laurie provided these tour de force reviews of the histories of pandemics, and again showed that what I just described in New Zealand has been repeated the world over, that we have often acted and then forgotten, and then acted and forgotten. And often in those actions, we've taken the opportunity to build institutions. But really, have we been able to summon the political, the financial support to make this a mainstream activity that is considered a priority in all seasons, and not just in times of crisis? So how do we escape the cycle? Luckily, I'm not the one who has to answer this question today. We have a very esteemed panel, and I'd like to briefly introduce them. You can read their profiles in the documentation. They're very impressive, and I encourage you to do so. But briefly, we have Julie Gerberding, who's the Executive Vice President and Chief Patient Officer at Merck currently, but was previously Director of the CDC and has enormous experience in both preparing for and responding to outbreaks. She's going to speak particularly around national efforts to escape this cycle and ensure national preparedness. We then have Jimmy Kolka, who many of you will know, who was previously Assistant Secretary for Global Affairs at Health and Human Services, where he represented the US government at governing bodies of the World Health Organization and the Global Fund. Before that, he had a long career in the diplomatic service, including being ambassador to Uganda and Burkina Faso. And he also worked for a time leading HIV efforts at my former home of UNICEF. We have Suzette McKinney, who's the CEO of the Illinois Medical District. Previously, she was a Deputy Commissioner in the Chicago Department of Public Health, and she's also, among many other activities, a co-chair of the National Academies Forum on Medical and Public Health Preparedness for Disasters and Emergencies. She has experience at addressing this issue from global, national and local levels, but we're very pleased that she's going to focus her intervention on the local response, which in many ways is the most important. And then last but certainly not least, online, I hope that we have Peter Sands, who's showing his own resilience, modelling this personally to overcome infection and disease, to be with us remotely. He's giving his apologies. He hoped to be with us in person. He's currently Executive Director of the Global Fund. Previously, he was Chair of the work of the National Academies on the Global Health Risk Framework, which I'm sure many of you were aware of or were even part of. He's also published on public health, pandemic financing from his work at Harvard. And previously, he had a long career in the private sector, including being Chief Executive of Standard Chartered for over 10 years. So we hope with this very august panel we can address this issue of how to escape this cycle, how to make pandemic preparedness something that is a stable, integrated, systematic activity rather than an enterprise that makes gold mining seem like something with a stable trajectory. So with that, we will have approximately 10-minute interventions like yesterday from each of our panelists, and then we hope to have time for a very robust discussion. So I'll ask Julie to start us off.